Hey guys, I wanted to make this video to help out Rockin' Roberta with the video about a question that a viewer of her or a subscriber of hers asked. And the question was, how well does Suboxone work for pain management? Now, when she asked me this question to answer, I first of all said I am not a medical provider of any sort. I am not a doctor. And for that particular person, they should go to their doctor and ask their doctor about it. But this is my opinion, my only opinion. I am not an addict. I am not someone who uses opiates, and I'm not someone who uses Suboxone either. I have worked with a lot of people who are on Suboxone for opiate addiction, and I have actually never really met someone legitimately who was on Suboxone for pain management. Now, when it comes to pharmacology and pharmaceuticals, typically sometimes doctors use prescriptions that are meant for something like, for example, propranolol. Propranolol is used for high blood pressure, so it lowers your blood pressure. However, it can be prescribed for anxiety because it decreases anxiety. So that's like an off-label sort of usage of the medication, and that is under your doctor's practice. So, yeah. But with Suboxone is an interesting question to ask about pain management. Particularly, this person is just like done with opiates in general, done with taking so many painkillers, is not happy taking these pain meds, and is in a condition where they are required to take pain medication, and from my knowledge, they're unable to cope properly without pain management, and they want an out. They want an out of opiates, and they want a solution, and they asked about Suboxone. My first reaction to this is I've heard from people in the clinic, patients, who don't exactly always tell the truth, but sometimes Suboxone is prescribed for pain management. This really comes to a shock to me because Suboxone not only has buprenorphine in it, but it also has naloxone in it, which is an opiate blocker. And if you want to go down the science of it, you could research it yourself. It's like a whole technical thing, an antagonist, whatever you want to call it, whatever. In my mind, it's just an opiate blocker, so it doesn't give you the high of opiates, and it satisfies your brain. When you're an opiate addict, you get all these happy transmitters in your brain, and you condition your body to have that. And when you get off it, you go through these major withdrawals, and these major withdrawals can be deadly, and it's really horrible. And people more often, not more often than not, typically Suboxone is prescribed when someone is going through withdrawal. The reason behind this is the risk of someone going into medical withdrawal. So let's give an example. If someone's taking heroin for that day and they're prescribed Suboxone, and they take Suboxone the same day as they intake the heroin, it will put them on full-on withdrawal, medical withdrawal, and it can be deadly. So there's that information. Again, don't trust me. Don't trust what I'm saying. It's coming out of my mind. It is what I have learned. When it comes to Suboxone, I rarely ever hear of people taking Suboxone for pain management. The only reason why is because this medication was geared to help people get off opiates and to satisfy the need of in the brain receptors of that opiate, and to decrease cravings of opiates. Now, when it comes to pain management, I've heard different reviews when it comes to pain management, but honestly, I have learned more often than not when people undergo some painful injuries and they say to me, Sid, I really wish that Suboxone helped me with my pain. I'm a little taken aback because it's supposed to help you with pain in some regards because it is a form of opiate. However, it has that blocker in it, so there's that. But not in the off-label use, but it can be treated for pain. So I hope that makes sense. I hope that makes some sense. Subutex. Subutex is kind of different than Suboxone. Subutex just has buprenorphine in it. And buprenorphine is, let me just get my dictionary back. I should have had this all prepared for me. Buprenorphine is a narcotic to treat pain as well addiction to narcotic pain relievers. So it's to treat pain, but as well on top of that, to treat an opiate addiction. Now, this doesn't have to be an addiction per se. It could be a dependence. So, one thing that can be interesting is they went through trials of this, and, I think this is more beneficial than actually sublingual buprenorphine. But they went through trials of injecting buprenorphine into the body. This forms a little bubble in your body, and you are unable to mimic it. You're unable to sell it. You're unable to take it out. You could try to take it out of your body, but it's really hard. But I've seen people really react really well to it. And you can't overuse it because it's in your body already. I mean, you could take more Suboxone on top of that. What my question for this person is, what are the symptoms that you are having that is making you feel as though that you do not want to take pain relievers anymore? Like, is it a psychological issue? Is it a side effect? Is it everything? Are you just done with the painkillers? You don't want to be a slave to it? There's many, 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 many different factors. And I totally understand reaching out to the internet and reaching out to a person who's on Suboxone. But you have to realize Suboxone is typically treated for opiate addiction. And this is because, again, Suboxone has both buprenorphine in it and naloxone. And it is to manage opiate dependence. So in a way, it can help you if your body is dependent on opiates. And of course, you will have to be under the care of your medical provider. I highly, highly suggest being 100% honest. If you are undergoing all these opiates all at once, you are given so much opiates, and you suddenly decide to switch to a new doctor and go on Suboxone, you can go into full-on withdrawal, and it could be very dangerous. So I'm just putting that out there. And so it's a tricky question, and I think a lot of doctors would be very hesitant to put a person on Suboxone if it's for pain management, because it has the naloxone in it. And the buprenorphine is a opiate, but it isn't as strong as the opiates that you are currently taking. And from my knowledge, I believe that your doctors are saying you cannot live without these opiates because you are in so much chronic pain. You cannot actually